Hi, Bethan. How are you today?
Good, thank you. How are you?
Really good, really good. Well, thank you for taking the time to be in this interview. I know there was some restriction to being face to face due to work obligations, so I really appreciate you attending the Zoom meeting instead. As I
No worries.
mentioned to you before, today I'll be asking a few questions to better understand your area of study, which is dietetics. How long have you been studying dietetics for, and where are you up to in your degree?
Yeah, I'm in my final year. So this is the 2-year master's. So pretty much 2 years I've been studying for.
Awesome. Well, congratulations for being in your final year. I
Thank you.
won't take up any more time, however, and I'll get into the first question if you're ready to go.
Yep.
So, Bafin, speaking on dietetics, what are some of the crucial elements surrounding dietetics, and how might this relate to the healthcare system, or healthcare team, might I say, as we're all in the same system?
Yeah. Well, in terms of, I guess, crucial elements, nutrition itself is crucial or essential. And we as dietitians, we're there to provide nutrition therapy to help like manage and prevent illnesses, especially things like chronic illness or, eating disorders, things like that. It's got a huge impact from a clinical perspective as well on just like the recovery and outcomes for patients too.
Yeah.
So tube feeding might be a big example from a hospital perspective. Being able to provide that kind of support can directly influence a patient's recovery. And yeah, like huge psychosocial aspects to all of it as well.
That's awesome. Yeah, I find that really interesting as nutrition and food intake is a crucial element in day-to-day life, as you would know. So, thank you for highlighting some of the points relating to dietetics. I'll move on to my next question. However, the rationale behind health and well-being differs in physiotherapy. So, for example, as physiotherapists, we focus on physical rehabilitation and injury prevention as an example.
Mm.
So can you explain your understanding of health and well-being while studying to be a dietitian?
Yeah, I think my understanding of health and well-being has probably changed a little bit now that I am studying, but I've realized that, it's not always just the physical, but there's such a mental aspect to it. There's a social
Yeah.
factor to it and even cultural things when it comes to a person and how, they eat. While all we're doing is aiming for sustainable long-term goals for that person.
Yeah.
So that part really helps me understand why, like patient-centered care, which we hear a lot in our studies, is quite important because it's such an individual experience.
Yeah, especially that point you brought up about mental, because in a lot of professions, a misunderstanding is that everything is just physical, but that mental well-being, yeah, is really, really important. So, I think a
Definitely.
misunderstanding some people might have is that our professions might not intertwine as much. However,
Mm.
based on what you mentioned, we are in the healthcare team together, and there are correlations between professions regarding health and well-being. So, I think that's really important.
Yeah.
Moving on to my next question, however, based off your experiences while studying, how does your understanding of health and well-being differ in your personal life or outside of the workplace, since you've gathered a lot of experience and knowledge now?
Yeah, I mean, I'd probably have a pretty similar response. But yeah, I'm seeing health and well-being personally, as finding that balance as well. So taking care of those same things, mental health, emotional health, and physical health as well. So
Yep.
whether that's eating well, staying active, sleeping well as well, and being social when I can.
Yeah, that's awesome. So some really important points once again. How our experiences and knowledge can really influence our personal life as well, not just the
Yep.
clients, which is really
Yep.
good. You've had some experience during placement as well, and as well as case studies throughout your study. What are some of the problems or patients? What are some of the problems that patients come looking for assistance with? Are there any common issues between patients that you see?
Yeah, definitely. Especially having done the hospital placements or clinical placements, malnutrition is a really common one, I think, for us.
Yep, yep,
Loss of appetite and like unintentional weight loss is a really big referral reason, where we aim for that high energy, high protein diet. And then in terms of other case studies, we might have looked at for like longer term chronic disease management,
gotcha.
probably things like diabetes, heart disease, kidney disease and supporting people through behavior changes. We constantly practice something called motivational interviewing in those case studies because it's just so important to have that input with behavior change and counseling at someone almost.
Yeah, that's awesome. Like every profession, Evan, I guess you would agree. Lots of diverse cases, but really some specific ones to your industry as well, which is really, really important to understand as a physiotherapist as well.
Yeah.
Heaps of things to contain and manage when it comes to clients. So I'll move on to my last question about it, Finn. I think this leads perfectly onto this one as well. What is a summary of the process when addressing a client? You know, those initial consultations you have, and do you receive updates throughout their journey or their progress as well?
Yeah, so with initial consults, we usually follow almost like a framework or a template where we'd go through like an ABCD kind of module. We take some data on anthro, biochem, some clinical data, and then take a diet history as well.
Got you.
And then from there, we can use that to make a nutrition diagnosis and then have a little plan or goals to set with the patient. So we'd pretty much in our plan, monitor all of those sections. And we'd also plan to have a follow-up. So if it's a review in a hospital setting, probably, depending on the situation and severity, could be daily, could be weekly, for example, if it's a rehab ward. In an outpatient setting, though, follow-up, it's probably like there's probably a bit more time in between reviews.
Yeah,
But yeah, we would definitely touch base with patients.
got you. Yeah, so it's more of a one-on-one consultations and things like that.
Yeah.
Do
Yep.
you ever work in groups within your profession, or is that pretty abnormal or anything?
No, absolutely. Depending on, what the niche might be, things like cardiac rehab sessions is the group
Got you.
education, or,
Yep.
oncology, cancer rehab, things like that. So lots of group education as well.
Super interesting. Yeah, I guess it depends on the case when it comes to monitoring as well. Just like you
Yeah.
mentioned before,
Yeah.
you really want to have that care. It's great to see that you have that care and management for your clients throughout their journeys, which is really impressive. So
Yeah.
that concludes the interview, Badfin. So a really interesting outline on dietetics as a profession. I think it's fair to say
Right.
that both physiotherapy and dietetics share many similarities and differences, but can
Yeah.
go hand in hand when addressing health and well-being. If you don't agree,
Absolutely.
yeah,
Yeah.
100%. Once
Absolutely.
again, thank you so much for your time. Good luck with the
No
final
worries.
year of your course as well,
Thank you. Thank you.
and I hope
And
to
good
see
luck
you
with your
soon.
course.
Oh, thank you so much. Yeah, thank you so much, and I hope to see you soon, Badfin.
Perfect. Thank you.
Bye. Have a nice night. Bye. Bye. Bye.
See ya.